Today on the program, we are talking about the process of step therapy, or sometimes known as fail-first therapy. And with us on the program, Dr. Anita Afzali. And Dr. Afzali is the medical director of the Ohio State University Inflammatory Bowel Disease Center. Also with us, a man who takes care of pediatric patients, Dr. Ross Maltz from Nationwide Children's Hospital in Columbus. And I'd like to thank you both for being here today. First, Dr. Maltz, tell us, what is step therapy?
I usually call it actually fail-first therapy, and it's really actually made by the insurance company. The insurance company sets where patients should start with certain medications first, and they have to fail that medication in order to get to the next medication or the medication that the provider has prescribed.
Dr. Afzali, is this something you see often?
Oh, goodness. Often, very often. I'll say that this is an unfortunate process and game that myself as a prescriber and doctor has to play very frequently for my patients in order to advocate for the appropriate therapy and care for them. It's not uncommon where at least once a week I'm having to make a phone call. What this call is for is towards the insurance company as a quote-unquote prior authorization, in order to get the insurance company or the payer to pay for or cover the cost of a specific medication or study that I would need for my patients. So it happens often where it's taking hours a week potentially to get the appropriate treatment for my patients.
And how does this impact the patient?
Immensely. What's happening here is basically what happens is I write for a prescription or medication, but the insurance company wants the patient to first try another medication and fail that first. So this impacts the patient potentially because now there's a potential delay in appropriate medical treatment. It could be, in fact, more costly because of this delay as it impacts their disease, their ability to actually respond to the treatment. During this time, the patient may require additional care by myself, either in clinic or even hospitalizations, unnecessary potential surgery specifically for inflammatory bowel disease, which is my specialty. So it impacts the patient immensely.
And Dr. Maltz?
In essence, as a physician, we have, an algorithm of how we like to treat patients. Sometimes I will start a patient on, medication X, and if, they're not responding after a certain time, I have, a plan A, B, C, and D, of different options of medicines that I want to go to. But I would like to start with the best medication first rather than have them fail on that and give them a medication that more chances than not they're going to fail on.
I was going to say, unfortunately, step therapy puts the decision about the most effective medications in the hands of the insurance company or the payers and takes it away from myself as the doctor and, more importantly, takes it away from the patient of what's appropriate potentially.
Today on the program, we are talking with Dr. Anita Afzali, who is the medical director of the Ohio State University Inflammatory Bowel Disease Center. And we also have with us Dr. Ross Maltz from Nationwide Children's Hospital. He also specializes in IBD, or inflammatory bowel diseases, like Crohn's and colitis. I guess my next question is, Dr. Maltz, does this have a negative impact sometimes on patient care?
Some of these medications can take weeks or months before they even work, so that can really, delay them from getting on their proper medication. On average, I try to do, if I can't get around the insurance company, I'll try to start them on a medication and kind of make sure that we're watching them very closely and talking to them and having them come back for follow-up and maybe reassessing things in, either a couple weeks to even like 2 to 3 months later and kind of seeing where we're at that point. I've had patients that I've tried to go through the insurance company and they denied it, and we had to start them on the other medication, and they clinically got worse over time. And, if they were started on the medication that I originally wanted them to be, they wouldn't have had to go through weeks and weeks of suffering and worsening of their disease.
Back to Dr. Afzali for a moment. I know right now in Ohio, the General Assembly is considering House Bill 72 and Senate Bill 56 that addresses step therapy. Tell us about that.
Yes. So these bills were introduced to help this process. And to begin with, to be clear, neither bill will outlaw the step therapy, but rather the aim of these bills is to make the process more transparent and quicker for patients who may have exceptions to the process of the step therapy or fill first guided by the insurance companies. So basically, the bills require the insurer's process for requesting the step therapy or fill first to override, if we're trying to override and get a particular medication, for this process to be more efficient and transparent for us as the doctors.
And Dr. Maltz, your view on these two bills, House Bill 72 and Senate Bill 56?
Yeah, so number one, I'm a big advocate for this bill. It's really not a mandate. The bill is not a mandate to really to make sure that we're prescribing certain ways, but it's really trying to set up like clear and easily accessible process to get exemption from step therapy, which is really important for physicians. Like I said before, a lot of times we're trying to get patients on proper medications and trying to go through the insurance process, which is really time-consuming for my staff and can take a really long time for patients to get on. So this House bill helps set up a exact guidelines on how long exemption process should take. So emergency is within 24 hours, but if it's not an emergency, it should be within 72 hours. I've had patients go weeks without even getting anywhere with the insurance company, so that on its own will be a huge improvement. It also creates exemptions for going through step therapy if it's contraindicated, if there's adverse effects. If I know it's going to be ineffective, which is very common based on sometimes the type of disease. Sometimes patients, their insurance company changes, so they've already actually completed step therapy, or they've already tried a medication and their new insurance wants them to retry that medication because they want them to restart step therapy. So this bill helps prevent that. Or I had about a year ago, one of my patients with ulcerative colitis was doing really, really well for about a year and a half, 2 years on her therapy, in remission. Her intestines were completely healed. The father got a promotion and changed jobs, and with the new job came new insurance company. And then the new insurance company wanted the patient to start on a different medication and wanted them to go through step therapy. And at that point, the patient was doing well for a year and a half, 2 years on that therapy. We didn't want them to go through step therapy because everything was going so well. And this bill would really prevent them from doing that. It would really prevent families from making that hard decision whether to take a new job and change insurance companies.
And Dr. Maltz, is this something that just affects those with inflammatory bowel disease?
No, I speak to my colleagues that take care of other chronic diseases, and they're having the same exact problems that we're having with that IBD providers are having every day. So it is not just focused on just one disease. It is most likely focused on numerous diseases.
Dr. Afzali, I know that one of the arguments in favor of step therapy, or what's sometimes called fail-first therapy, is that it's a money saver, not only for the insurance companies, but also for the patients themselves. But I guess in the long run, the question is, does it really save?
Yes and no, right? And so what we do know is, sure, the step therapy process is intended to save insurers and patients money by steering patients to lower-cost prescription drugs. Unless, of course, higher-priced ones are absolutely necessary. So, in theory, this could be cost savings for the patients, the payers, and on a national healthcare system model on a national level. It could be cheaper, but that's the issue is that this is at the expense of the medication not working for the patient is where the issue comes, right? The expense of a delay in appropriate treatment for the patient is where the issue comes. And we know that this could, in fact, be more costly to our patients. And what I mean by cost is if we're advising our patients to be on a medication that I myself as a doctor and prescriber already knows that it's ineffective, then specifically for the disease of inflammatory bowel disease, such as Crohn's or colitis, what we know is that any delay in appropriate medical treatment for my IBD patients, it's highly impactful for the patient and their disease and outcomes. So my patients typically have a very small window, really, for appropriate treatment and whatever that treatment may be. And so if there's a delay in that treatment because the insurance companies are advising me that they first need to be on drug X or Y, then now what happens is, again, as I referred to earlier, my patients are going to have to see me in clinic more often. They're going to potentially have unnecessary hospitalizations. There's going to be an overuse of corticosteroids or prednisones, which we certainly know has both short and long-term side effects. There's going to be impact of having unnecessary and even urgent surgeries, severe anemia, severe malnutrition. I mean, my goodness, the list goes on. And so this delay in appropriate treatment that I'm prescribing, for the therapies that I'm prescribing, can actually be more costly to the patient and their health and well-being, and then also to the insurance companies and the system nationally. So we actually have studies demonstrating that when there's a delay in appropriate treatment, this was Medicaid studies that actually evaluated this, and I believe it was in Georgia, but when there's a delay in medical treatment for IBD patients, it led to additional higher health care costs to the system because of this delay, because of the aftermath, if you will.
Our guests on the program today have been Dr. Anita Afzali from The Ohio State University and Dr. Ross Maltz from Nationwide Children's Hospital, both specialists in inflammatory bowel disease. If you have any more questions about this topic or House Bill 72 or Senate Bill 56, you can contact the Crohn's and Colitis Foundation. Their website is crohnscolitisfoundation.org. Again, that's crohnscolitisfoundation.org. Thanks so much for listening.